I think people just at the end of the day want to connect with like a real person. Um, and so just like be yourself, try to get to know people and keep an open mind. But, work hard too. And, make an effort to get to know people, make an effort to get to know your organization and put yourself out there.
Good evening, everyone. My name is Vrushangi Shah, and I'm here with the American Journal of Healthcare Strategy with our Fellowship Review podcast. After a long break for the summer months, I'm so excited to be back and recording with current fellows as well as former fellows. And today we have the absolute privilege of speaking with a guest who is post fellowship and has an incredibly accomplished career. Rachel, welcome to the show.
Thank you so much for having me.
Yeah, we're so excited. We'll jump right in. But very first, can you give our listeners just a brief overview of, who you are, where you're from, and where you currently are?
Yeah, sure. So I am Rachel Gerhardt. I am originally from Worcester, Massachusetts. I will get into more detail, but just very high level. I started my career working when I first graduated from undergrad. I worked at Boston Children's Hospital. While I was there, I went back to school part time to get my master's degree and have a master's of public health from Boston University School of Public Health. And then I did a fellowship at Johns Hopkins Medicine after my time at Boston Children's. I've moved around a bit. I ended up in Pittsburgh, and then I moved back to Boston just about a year and a half ago now. And I'm currently working at Beth Lahey Health, and I am a director of integration working across the health system.
How incredible. I'm very excited to get into all the parts of your journey and the various health systems that you've worked at and the cities you've lived in. But first, I want to start with the education piece. Tell us about just high level, maybe what stood out to you about getting an MPH at Boston University, and just overall, what was your grad school experience like, assuming you may have gone to grad school pre-COVID?
Yes, I did go pre-COVID. So yeah, I think I have a bit of a unique story of sort of how I got here. So as I said, I started working right away when I graduated undergrad, and I went to Tufts University outside of Boston. I did not know what I wanted to do. I had actually done an internship my senior year there at Boston Children's Hospital, and it was actually in their social work department. I didn't know that's where I was going to be for that internship. But then I needed a job when I was graduating, and my preceptor at the time, said, "Oh, you should apply to these entry level positions at the hospital." Again, I had no idea what I was getting into. So she sort of referred me to the neurology department. They had an opening as an ambulatory service representative. I, again, had no idea at the time what that position entailed. I remember like asking in the interview if I was going to be working with patients or if I was going to see patients. But long story short, I ended up starting at Boston Children's. That was in June of 2013. And I was a patient service representative in their neurology outpatient clinic. So I was doing a lot of scheduling. I was answering the phone, sort of that first point of contact for patients as they called in, doing insurance referrals, sending messages to the nurses, doctors, NPs, and really had a lot of exposure to healthcare access and some of the challenges that patients were experiencing. And I didn't know that, I didn't know healthcare administration was a career at that time, to be honest. I knew I liked working with people. I really felt like that hospital environment, once I started working there, was really great and I really enjoyed it. But again, I didn't know sort of what the next step was if I wanted to keep working in this field. So I started to do some research on my own, and I was sort of looking at other leaders in the hospital that had different degrees. And I realized if I wanted to keep working in a hospital and work my way up in hospital administration, I probably was going to need to go back to school. So that's sort of how I got to the graduate school piece. And then for me, I needed to keep working full time. So I was looking for a program that I could do part time. So my goal was to keep working at Boston Children's, start taking classes, sort of work towards that. I really fell in love with the MPH program at Boston University. One, I could go part-time, but the MPH for me was really something I was passionate about. I had actually in my undergrad majored in child development and community health. So I had sort of that piece and that background and was really interested in social determinants, and again had now some exposure to sort of healthcare access and quality and cost and some of the challenges. And the triple aim was like a big thing that was talked about. It still is, I know, but that was a big hot topic at the time too. So the MPH to me just aligned with my values and what I was interested in and what some of my previous education had been in. And so it just fit and made sense that I could sort of keep working where I was. And I started to take classes at night. I took one class at a time because I was nervous about how I was going to make that work with working full time and taking classes. But I slowly ramped up. I think the most I took was 3 classes at once. But I would take the bus from Children's over to BU School of Public Health, or sometimes I would walk if the weather was nice. And I sort of just slowly chipped away at my MPH, and it took about 3 years. But I had a unique experience since I was there part time, and I sort of would pop in at night, and then I would be gone. And during the day I was working, but I loved it. I'm still in touch with some of the professors there, and really had a great experience.
That is so incredible. And a couple of things that I do want to highlight from your response for our listeners, number one, the value of having a good preceptor who's willing to refer you and guide you in the right direction. It seems like early on in your career at Boston Children's, you had someone who was kind of guiding you in a way and maybe helping you get a little bit more aligned, with the path that you were meant to be on. And the other thing in that role, it seems, there's a lot of value in being in those frontline roles where you can truly see, what our staff are seeing when it comes to providing patient care. So I think, I would urge our listeners to not shy away from roles that are outside your comfort zone, that maybe require you to talk to patients and also talk to physicians and clinical staff. And so I appreciate you highlighting that. And the last thing I'll kind of point to, just to reiterate, is you said something about how going to BU while also working at Boston Children's aligned your values and it felt right. There's so much importance that I put on value alignment. And so for anyone that is going to decide on a graduate school or even going to decide on a fellowship, I think, take that advice that Rachel said. Figure out what your values are and see if the program is going to align and get you to where you want to be, after the program 5 years down the line or even 10 years down the line. So I so appreciate you, sharing all of that. And, that kind of brings us to your time at Hopkins. Of course, you did incredible work at Boston Children's. Before we even get into what you did at Hopkins, how did you find out about administrative fellowships? And then after you found out about them, what was your why, or what really drew you to pursuing one?
Yeah, so, again, I'm very thankful for the job I had at Boston Children's. If I hadn't had that job, I never would have realized healthcare administration was even a career path. And I'm really grateful to the points you said, that I did have that work experience first and sort of understood what was happening day to day in some of these outpatient settings. So, I think as I was wrapping up my MPH, I was starting to think about sort of what was next for me. I was feeling a little stagnant. I had been at Children's for about 5.5 years at that point in different roles, including my internship time. And I was just thinking, what's next? Like I've only also on the personal side lived in Massachusetts. I had nothing besides my family tying me to Massachusetts specifically. And I was sort of getting this like itch to maybe really like go somewhere new, which was, I'm very much a homebody. So this was like really different for me to say like I might leave here, like maybe I want to go do something different. But honestly, I came across fellowships by just doing my own research. So it was a different time. Like people weren't posting on LinkedIn when they got a fellowship. It was not like how it is today. And honestly, that was only 7 years ago, or maybe 9 years ago when I applied. But it was very different. And so I did find something honestly on the BU Public Health website. I found like a link about administrative fellowships. I did all of my own research. I started reaching out to different programs and like making a list. And I think what drew me to it was, I've always been very ambitious. I've always had high goals about where I want to be and what that looks like. I was a college athlete. I was a national champion when I was in college at my sport. Like I've always sort of set that bar high for myself, that I really want to be performing the best, be the best that I can be, and always look to keep climbing. And I was reading about an administrative fellowship and just felt like that also, to your point about values, like aligned with my values, and also was an incredible opportunity to really advance your career in healthcare administration and give you exposure to so many different parts of running a hospital and hospital operations and strategy. Like it wasn't just sort of, keeping you in one bucket. There was just an opportunity to explore so much as part of a fellowship and to interact with the executives of a hospital. Like to me was mind blowing. Like I remember seeing the CEO at the time of Boston Children's Hospital occasionally walk through the lobby, and I would be like starstruck because I would see this person walk through the lobby like, oh my God, she's the CEO of this hospital. And then to fast forward to a fellowship where you actually are interacting with and meeting and talking to and executives, and they know your name. I mean, that is an incredible opportunity that I don't take for granted and I'm very appreciative of. So that to me, like that whole package is what really made me want to pursue a fellowship in the first place. And then I didn't really know where I wanted to go. But I sort of compiled a list of academic medical centers all over the country, to be honest. Some children's hospitals, because I did feel strongly about working in a children's hospital, but I also liked sort of the academic teaching mission too. So I looked all over the country, to be honest. I had a couple Massachusetts places, but sort of compiled my list of, from California to the East Coast, basically.
I love to hear that. Lots of similarities actually between your journey and my journey. I am also a homebody, and so I totally understand that. One piece of thing that I do want to call out from your response, especially for our listeners, various graduate programs will have a different level of involvement when it comes to helping students acquire fellowships. But, you called out a really good thing. You found it on the BU website. And so I just want to urge our listeners to refer to your career services, refer to your school's websites. If they are a little, less hands-on when it comes to fellowship help, there are other resources. Of course, listen to our podcast, go on LinkedIn. There's often people who will offer free help for fellowship review of resumes and personal statements. So even if you don't know, the point is, even if you don't know a lot about administrative fellowships, there's a lot of resources out there to guide you as you navigate a very competitive cycle. Um,
And
and yeah,
can I
go ahead.
just add one thing to that? So, again, I was unique. I found that on my own, but there usually is someone, to your point. Like there was a professor, I'll call him out because I still am in touch with him and he's great, Professor Chris Lewis at BU, who actually was who I should have talked to about applying to fellowships. I just didn't know that. So to your point, it's really important, like do your research, but ask around too, because usually there's someone that, can help you and sort of give you that guidance and connection. And eventually I got connected to Professor Lewis, and he did help me once I started getting interviews. So I just want to make sure that I shared that I did have, that support once I realized I should be talking to someone.
No, absolutely understand. And I'm sure your professor will appreciate the shout out. I also want to dive just a little bit deeper now, after understanding your why into your experience at Hopkins. And so, you had a unique experience. You were in a way doing two roles as we kind of chatted offline. So how did that happen? And, what stuck out to you? What are some things that stuck out to you about the Hopkins Fellowship in general?
Yeah, so definitely like the experience I had there, looking back, it never goes exactly how you're planning it to go, and you don't really know exactly what's going to happen. But I was super excited that it was a 2-year fellowship and that I would be rotating around, the health system. Because I had some children's hospital experience coming into the fellowship, I did get sort of paired. My advisor was the chief administrator of their children's center, which is their children's hospital. So I did start initially to spend a lot of time in the children's center at Johns Hopkins. That had pros and cons, which I can talk about later. But I initially thought like, wow, this is great. Like there was an assistant administrator, which was a pretty common role that a lot of the fellows at Hopkins went into post fellowship, but it wasn't something that was on my radar like during fellowship or after, or immediately after. Um, However, some of the fellows also at Hopkins had opportunities to do interim management roles. Usually that happened more towards their end of their second year of the fellowship, and then would sometimes lead into, that ended up becoming their role post fellowship. Um, I think I was just in a bit of a weird, unique position, and it was all sort of about timing. So I did start my fellowship normally. I started doing rotations. I spent time in the Children's Center, but then I went other places too and did rotate around the health system. But then I think it was towards the end of my first year, um, the assistant administrator of the Children's Center was leaving to take a different job. And so I was approached about stepping in interim to that role. And honestly, I felt conflicted because if you had asked me 7 months before, to me, that was like my dream job post fellowship. But then I was really enjoying also like rotating around and seeing all these other things. But I did decide to take that interim role because one, I had never been a manager. I didn't have that management experience yet. And that role doesn't open very often. So, I really jumped on that opportunity. One, they thought of me, they asked me if that was something I was interested in doing. And if I liked it, there was a high likelihood that I would end up officially like applying, and then that could be my post fellowship job. It just happened earlier in the process, which I think caught me off guard a little bit. But I jumped into that role as the interim assistant administrator, which really was overseeing the day-to-day operations of their children's hospital on the inpatient side. And it's a 205-bed children's hospital at the time. And I was directly supervising different directors in that area as well. So at the time, I'm like, wow, I had no idea what I was doing. I should never have been in that position. But I learned so much from that experience. And you might ask me this more later, but I ultimately decided to not take that position and do something else, which, maybe was a little controversial, but that's sort of how I was in my experience. So I didn't stay in that position. I ended up deciding to pursue something else, but I learned a ton from taking that opportunity.
Absolutely, absolutely. And I think, the fact that you were uh, given something like that so early on speaks to the value and you bring and the caliber. So knowing you in this little bit of time, it doesn't seem shocking at all. But what I want to highlight is a lot of it is timing, right? Fellowships,
Totally.
oh, there is a certain level of structure, whether it's rotational or a project based, you never really can anticipate. And things like this happened, I think, more than people realize. I know several fellows that, like 2 months into their role, they were offered something incredible, or they were on month 8 of 12 months and they received an offer. So it's really important to, trust the timing and know when to kind of take these opportunities. But you left a little bit of a mystery. So, you said you didn't stay in the role for too long. So what was that something that you ended up leaving for?
Yeah, so my struggle, I was very grateful for the opportunity and I was learning a lot. But my struggle that I kept coming back to was that I decided to pursue a fellowship to really get exposure to the full health system and learn and see as many different areas of a hospital and health system that I could. And the struggle and like internal struggle that I had was that now I was in an interim role. And so I was in one place. I didn't sort of complete the fellowship in the sense that I had more places that I was supposed to rotate to. I had more areas of the hospital and the health system that I wanted to see. So I started to think a little bit of like, okay, what was my reason for doing a fellowship? Did I do it just to like get a job? Or did I do it because I really wanted exposure to like every possible thing I could? And this is really where I think, the value of the fellowship comes in, because the value of the fellowship is not just that you get a job. It's not just like, oh, people think of you and you get a job. It's that you do get to experience every area if you want to, and if you take advantage of it, of the hospital and health system, if you're in a program that rotates at least through everything. So I started to feel like I was sort of maybe shortchanging myself if I didn't take full advantage of doing that. And as fellows at Hopkins, at our different classes, we actually did like lunches or dinners with different executives. So we would sort of reach out and meet with different people, and it was just three of us at the time that were in our fellowship class. So it was really small and intimate. And when we would do that, I would think like, oh, maybe I should try to like meet with that person, or maybe I should try to work with them, or maybe they have a project that would be something that would be interesting to do. And my brain started to think like, you know what, I don't want to pigeonhole myself here. And I've had this children's hospital experience. I'm now the interim assistant administrator of the children's hospital. Everybody is sort of thinking of me as children's hospital, which is not a bad thing. But again, I had to come back to like, what was my reason for doing the fellowship? And it was an amazing job, but that it was only a year in, not even. And I wasn't ready to say, oh, I'm just going to stay here for the rest of my time. So I decided to totally go a completely different route. And at the time she was, or she still is, Dr. Lisa Ishii she's now actually the fellowship director, but at the time she was a newly SVP of health system operations. And we had dinner with her, and then I met with her one-on-one because I was just fascinated by what she was doing. And she had never worked with fellows before. It was a new role that she had just been in maybe a year. And she was working directly with Kevin Sowers, the president of the health system. And I met with her and I said, Dr. Ishii, I want to work with you. And that was it. And I started working with her. And so I basically chose, that over staying in my interim role. And I wanted more exposure. I wanted to learn more. And it was really one of the best decisions I made from what I learned working with Dr. Ishii.
Thank you so much for sharing that. Early on you spoke about values, and so the underlying lesson from, I think, this response from you, again, and a good lesson for future fellows, current fellows, is really always go back to your why and figure out if your experiences are actually meeting your why and your values. So I absolutely appreciate you sharing that, and also probably took a lot of courage. I'm sure it was a very difficult decision at the time, to have this incredible experience, but then to wrestle with, well, it's not really meeting what I thought I was going to do or what I want to learn, And so that's very authentic of you to share. And so I hope the people listening can take away that you should always go back to your why, and you should always make sure that, you're gaining the most out of an experience as unique as a fellowship. Um, and you of course did your time at Hopkins. Before we transition to where you went next, for fellows that are currently interested in doing the Hopkins fellowship, of course fellowship is a big part of your life, but so is living outside of work and building communities and experiencing the city. And so tell us, maybe outside of work, what was something that was your favorite part about living in Baltimore, or even just, something that people wouldn't necessarily know about the area?
Yeah, it was the best decision I ever made, and I will always say this: like doing a fellowship in general was the best decision I ever made. But I loved Baltimore, and I think I was very fortunate that my fellowship class, I was with two other fellows, Daniel McFarland and Jay Spafford. We were really close, like right off the bat. We had all moved to Baltimore without really knowing many people. And I think that is what's a unique and cool thing about the fellowship, is that usually, not always, but usually people are coming from, out of state or out of town, and are just looking to sort of meet people and explore the city. And that, even when we went to conferences, like that's what I found from other fellows at different programs too, was there was just this immediate bond of like, you are doing this experience together. And so we quickly started spending a ton of time together. Like we had a list of all the different restaurants we wanted to try. We were going out together all the time. We were scooters, like were new in Baltimore. That was like when scooters had just been introduced. And so we were like scootering around the city all the time together. But I think it was just like immersing yourself in the city and in the culture. And again, like that was big, just like going out to dinner, exploring new places. When one of us met somebody else, through a different way, like we were just sort of bringing everybody together. I joined one of like the sports leagues in the city with my co-fellow Jay too, and we did kickball, and I think we did flag football too. And so we met a bunch of people that way. And then it just sort of like grew, like everyone that was sort of in our fellowship family and extended friends. And we really just created this great network of people. And it was really just, you have to put yourself out there, trying something new. It was sort of ironic because in Boston at the time, when I was living in Boston, the same sports league existed, but I was like, I never would have done that if I was still living in Boston. It took like moving to a new city and just meeting new people and totally being outside of my comfort zone to do that. And so I just would tell all fellows, like, take advantage of the city or town, wherever you are, where you are, and like, just go explore it. Like, find your co-fellows. If your co-fellows end up not being your people, then like meet people a different way, like do different activities in the city that you're in and just find people that way. But I feel like that's a unique part of the fellowship, is that you do get to meet people, and just sort of explore this like new place too.
Oh, absolutely. I love getting your take on Baltimore only because I feel that, the East Coast is stacked with incredible cities. You of course have Boston and New York City and even Pittsburgh. Baltimore is not one that comes up, I think, sometimes in that circle of maybe more popular cities, if you will. So I think this brings to light a new experience, and also the fact that, if you step outside of your comfort zone in a new city, you can truly find something that you will enjoy, whether it's food or sports. And so I appreciate the plug for Baltimore.
Yes,
Um,
they call it Charm City, and that's the nickname for Baltimore, and it's very true. Like, it really is a really awesome place to live, and I miss it a lot. So yeah, go
well, good.
Baltimore.
I'll definitely have to. I've been to the East Coast a ton, but Baltimore is not a place that I've had the chance to experience. So maybe in the near future. And so now tell our listeners, before we get to the fun stuff of what you do currently, there was one other organization that you had quite a long and incredible experience at. So where did you go after your fellowship and after your time in Baltimore?
Yeah, so I did not stay at Johns Hopkins after my fellowship, which again, never, like, I in a million years never would have thought I would have left. I will say, like, and I'm going to share this a little more than you asked, because I think that's a big reason that, current fellows or people looking for fellowship look at is, okay, did you do your fellowship there and then did you stay, or why did you leave? My second year of fellowship, at the end of that year, is when COVID hit. So that was definitely something that influenced some of that. I will also say, on a personal note, I had started dating an administrative fellow at UPMC, and he was from Baltimore. We met at ACHE in Chicago, so very funny administrative fellow connections, right? But he was at UPMC, and I was in Baltimore, both doing administrative fellowships. And at the end of our fellowship, we just honestly were sort of figuring out, like, is he going to move to Baltimore? I was like, I'm not moving to Pittsburgh. I'm not going to Pittsburgh. I'm not going to UPMC. I love Johns Hopkins. I'm staying here.
Sure.
Again, I think some COVID pieces of that played into my decision.
Mhm.
I did have a couple of offers to stay at Johns Hopkins, I will say, and turning those down was the hardest decision I've ever had to make. Well, not ever, but in that context, really hard decision to make. The decision that I was going to leave, and everyone was very supportive. I can remember specific conversations with some of my mentors at Hopkins, and I think that also showed, really how important those relationships are, and finding some good mentors, because the people that you want in your life and the mentors that you want to support you and to go to for advice, none of them are going to be mad that you're leaving or not taking a job or hold it against you. They might be disappointed and sad and want you to stay or want you to pursue that opportunity, right? But if there was someone that maybe gave you some negativity for a decision you made, or sort of cut you off, or was going to hold it personally against you, those aren't the mentors that you want in your life. That was a bit of a lesson learned there too. I mean, I sort of knew that, but it was very clear, the people that I had surrounded myself with were really supportive mentors. and encouraged me and understood why I was making the decision that I was making. And we talked
Mhm.
about it openly. And I will say that I have talked to some fellows since then. That is my other biggest piece of advice. If you are planning to potentially leave after your fellowship, talk to your people about it, talk to mentors, seek their advice, be open about it. You don't really want anyone to be shocked and surprised. It was really valuable to, again, the people that I trusted and was close with, and my mentors and executive leaders. I was honest with them and said, I am interviewing here and this is what I'm looking at. And we talked very openly about it before I made that decision. So I just wanted to add that because I think it's super important for fellows. So I made the decision in, I guess it was in May of 2020. That's when I made the decision to accept the job offer at UPMC. And, it was a great pitch that the UPMC had too. So I flew to Pittsburgh and met with a bunch of leaders at UPMC actually in March of 2020. So like many COVID stories that I can share about that time. But anyway, I met with Mark Sevko, who was at the time the president of the Children's Hospital there and was the director of the fellowship program. And, they really were going to sort of treat me as one of their past fellows, essentially, and provide some of the same opportunities. I met with, everyone I met with was wonderful. And the job itself was also part of my decision process because it was putting me into a director of operations role where I was going to have direct reports. And again, I really believe that management piece is very crucial, especially when you're earlier on in your career and you just need to understand like what it takes to manage people. And it's very challenging. I think it is the most challenging thing if you're managing people, and that the people part is what takes most of your time. But I'm
Mhm.
really grateful that I had that opportunity to sort of be thrown into that, managing physicians, managing staff, having those direct reports. Also, at one of the craziest times, as COVID is like still sort of new and going on, and what does that look like? But was really, that was a big decision piece for me too. Was like, what is the job going to offer me in my career growth and, my trajectory of where I want to go? There's a lot of talk of like picking between operations and strategy and which one do you like, you have to know if you want to go into ops or strategy. And that always confused me because I was like, why can't you do both? Why do you have to be one or the other? Why can't you do both? And now I can say like you can do both. And honestly, like operations roles also have strategy pieces to them. So
Mhm.
you don't have to pick and you can go back and forth. And that's like my other thing I always tell people if I talk to them of, you don't have to know I only want to do operations or I only want to do strategy. So anyway, that's how I got to UPMC. And then I moved on to a larger role there. I was the director of operations and then division administrator right before I left of general internal medicine. So it was a much bigger scope than what I initially had when I started.
Yeah.
And I really enjoyed that role and again learned a ton working in a department and managing people and understanding the operations.
Oh my gosh, how incredible. So much great advice in that response. And if there's one response that I can steal and just plaster everywhere for fellows, it would be everything that you said. So a couple things that I want to call out. Number one, didn't know ACHE was able to also sponsor love stories. So,
Yeah, maybe they don't
shout
know
out to
about that. So
well, look at that. I feel like it's a win-win for everyone. But no, one thing that you said, you said you left after your fellowship, and this is where I urge people who are currently interested in applying for fellowships to speak to fellows. Because when you look at a website and when you see former fellows and you see Rachel's name or somebody else's name, and you see that the fellowship year was whatever 2018 to 2020, I'm just making things up, and then immediately after you see, oh, this person is not or did not stay or is not at the org. Sometimes this is a lesson for me today as well, it's not the whole picture. So as we learned from what Rachel shared with us, life happens. And so sometimes it's just important to connect with a fellow, cold email them or message them on LinkedIn and say, hey, was there a reason that you left, or was it an experience that you had, to get insight. So I appreciate you, painting that picture for people, because I will be honest, when I was looking for fellowships, I definitely looked at people who were the most recent fellow and whether they stayed or not. And again, it was half of a picture. So appreciate you saying that. And the other thing that I want to call out is the maturity of the mentors that you told after or during your fellowship that, hey, I love Hopkins, but there are life things happening where, I'd love to stay, but I'm also open to, another city. And I think you said it best. You don't want mentors in your life who are not going to support you or not going to understand where you're coming from. And two things can be true at once. Someone can absolutely adore you and be sad that you're leaving, but not be angry and give you the wings to fly and take off and do what you need to for your personal and professional life to merge. So I think it seems like you had some incredible people in your life at Hopkins who truly understood your why and let you grow and let you kind of do your thing. So I love hearing people who are like, yeah, they let me do my thing and here I am. And the other thing about what you said in your roles as you progressively moved up at UPMC, again, I just want to highlight, Rachel already said this, but people management is so important. And the earlier on in your career that you can get it, I think it adds a lot of value to your skill set, to your learning, and then to your resume. So people who are going to the fellowship route, current fellows, or starting their fellowship already or soon this summer, keep an eye out for where you can get some people management experience, because it does add an added layer of value to your resume and to your skill set, opening up new opportunities post fellowship and later on in your career. And so, you obviously made quite an impact at all the organizations that you have been a part of, but you did give a little bit of a hint in your last response, saying you left UPMC as well. So, where are you now, and what do
Yeah.
you do?
Yes, so I am back in the Boston area. Again, like this is my theme. Like I never thought I was coming back when I did. Like I never thought I was going to any of these places when I did. So to your point, life happens. But I'm back in the Boston area. I married that fellow. That was the UPMC fellow, and we now have two children. And so we had our son actually in Pittsburgh, and it was really a personal reason for why we moved back here. So just realizing again life choices, and neither of us being from Pittsburgh, we didn't have family that was immediately close by to help with childcare and to see our son. And I just felt like if my family was going to grow, or if we had a second kid, we needed to be closer to
Mhm.
family. And we honestly, we actually looked at Baltimore too. My husband again is from there, so and I would have gone back there in a heartbeat too. So we did look at Baltimore, we looked at Boston, and ultimately, we ended up coming back to Boston. My husband actually got the job first. He's at MGH, and then I landed at Beth Israel Lahey Health. And again, very hard decision to leave UPMC. We both were doing well. Like I could have stayed in the job I was in. I wasn't necessarily ready to leave that job. It was really just again a timing thing and sort of life. Like we had just bought a house. Like we didn't think we were going to leave, but ultimately this has really been a great decision to come back and be closer to family. And again, I think your personal and your mental health and your well-being is just as important in all of this. And so you do have to figure out like what makes sense for your life, and your life is going to evolve. I started my fellowship 7 years ago, so it's going to change, and the decisions you make are going to be influenced by different life factors. So that's ultimately what brought us to Boston. But I'm at Beth Israel Lahey Health, which is a newer system. They merged actually right prior to COVID, but are still like COVID sort of delayed some things. And so it's a 14 hospital health system around the Boston area. And I am now more in a strategy role. So if you think of like operations, true operations, I am now in I guess, a true strategy role, and I work across the health system. And I'm actually, again, similar to a fellowship, I'm working now again with the senior and executive leaders of the health system. And that was a big draw to me, for me to this role was sort of, okay, I've done that operations work. I've done some of that management. I've worked in a department. I really like seeing the broad picture across the health system and sort of like, where are we going? How are we getting there? What does it look like? And I think I'm really most passionate about some of that strategy and that vision. And was very fortunate to connect with someone. Again, there was a personal or a professional connection that actually like connected me to someone. So like use those connections. Once you are in this world, it's a small world and people know people. And I had a very informal conversation first, which ultimately led to getting this job offer when I was moving back here, which was really great. So that's where I'm at now. And I'm currently on maternity leave. So
Well, I appreciate you doing this with me while on leave, but what I'll leave with the listeners from that experience of leaving UPMC and coming back to Boston, I do believe that when one good thing it has to come to an end for another blessing to come in or for another good positive cycle to start. And yes, it's absolutely difficult, but you are the prime example of, yeah, you can find the balance of having jobs that you love, but finding that peace, whether it's mental peace or just peace in knowing that you are balancing your personal life. You have the ability to put your family first to a certain extent. And so, as our fellows grow out of their roles, you will wrestle, our listeners, you guys will wrestle with the decisions that life will throw at you. But again, this episode is very big on values, and you have to go back to your values. If being near your family is something that's important to you, put in the effort to make that come true, where you can work and also have that family life that you desire. And of course, you seem to have done that so well. Um,
it's not that
so-
easy. Just to throw it out there, like there's definitely hard moments. Nothing is perfect. There's been many hard decisions, but just to like give people the real of it, it's really challenging. But I think you sort of make that decision and you work through it.
Oh, absolutely, absolutely. And kind of my last question to really close us out, you have shared incredible experiences and advice, but what one piece of key takeaway would you want to leave with our listeners, right? Like so far in your career, what is a piece of advice that has gotten you this far and helped you get successful?
Yeah, I think, the biggest thing for me is really being your like true authentic self. I say this like whether you're interviewing for a fellowship, writing your personal statement for a fellowship, or once you're in a job and you find yourself as a manager, right? And maybe you're a younger manager as I was, and everyone around you has way more work experience, right? But people relate to that if you're real. And I think you can tell if somebody is sort of putting on a facade or not being their true self. And I think people just at the end of the day want to connect with like a real person. And so just like be yourself, try to get to know people and keep an open mind. But work hard too, and make an effort to get to know people, make an effort to get to know your organization and put yourself out there. But just be real. And I think at the end of the day, that's really how you end up connecting the most with people.
Absolutely, absolutely. Such incredible advice. And I hope our listeners can get a lot of great advice from this episode, but also see how Rachel highlights that, you can find your way to and through a fellowship in very unique ways. There's no cookie cutter path. I think you're the perfect example because there is a perception of, I'm going to go to undergrad, I'm going to go to grad school, I'm going to do a fellowship, and then I'm going to stay there for X number of years. And I think this episode really challenged that norm in a positive way. And so, for anyone listening, I hope you know that there are unique ways that you can end up exactly where you need to be. Um, and Rachel, I again want to thank you. There's a time difference between us. You're on leave. You've taken the time to share your incredible journey. And I know there's so many good things for you in the future. And so thank you for your time and your incredible advice this evening.
Thank you so much for having me. It was great to chat with you about all of this. I love it.